fellow Americans, I report to you from deep in the command lair here at Liaison St. Fire District, or in my office, which I like to pretend is a lair. Um, the purpose of this video that I'm sending out to y'all is to kind of clarify some issues that are kind of hard to nail down when you make a memo. There's some things that appear to be unclear right now. Um, when we respond to calls, we also want to make sure that we're squared away on donning and doffing, when to wear the gear. So in this video, I'm gonna clear up some of the staging issues. I've got Lieutenant Brian Smith. He's going to talk about some of the medical issues that we're going to be responding to, and what we need to look for, and what gear is appropriate. And then we also have a demonstration of how to properly don and how to properly doff the equipment. First thing I want to talk about is the staging. So this staging, as the memo states, it's going to be, you're going to go to the residence, but we're going to stage outside. If at any point that the signs, symptoms, or reports that we either get from dispatch, some notes that we read on the CAD, or some indication from the people inside that this person has an acute illness, then we're going to spring into action and we do what we do. I mean, that's no question. So the reason we don't want to stage away is we don't want to give the parents that no one's coming. So if we're going to beat EMS, maybe they're tied up, 7 and 5 are tied up. So we can go there, we'll park outside. It's okay to make contact from outside. If the patient can come outside, we're going to be in the proper PPE, but it's a whole lot safer to be outside of an enclosed residence, out in the open air. But if it's not life-threatening, if it's not an acute illness, then we'll just advise that EMS is on the way, and they'll be here shortly. So what I wanted to clear up is how we're going to stage, why we're staging at the residence, why we're not staging away, because I still want to be able to jump into action if needed.
Based on recommendations, they're saying N95s, eye protection, gowns on any positive screening patients. If we don't have a positive, if we have a negative screening, then I don't think we need gowns, but potentially there's still potential there that they could have something going on. So if they, if they have any of those symptoms.
So if it's a negative screening, we're talking eye protection, we're talking N95 mask. Of course, we're always going to wear gloves.
Yeah, every calls will have a glove.
Okay, so now let's talk positive screening.
Positive screening, we're going to send one person. Well, positive screenings, we're going to allow EMS. We're going to let EMS go in. They can either cancel us, or if they need us, they'll designate whether or not we need 1 or 2 people going in with them. That'll be gown, gloves, eye protection, N95.
Okay, so the question is going to be, okay, once we go in, especially to a positive screening, what do we do with our decon? What can we decon? What do we need to throw away? So what needs to be our procedure there?
Gown, mask can be thrown away. We can decon our glasses, and I think LT Norton is working on what his cleaning solution that he's working on right now can be used to decon the glasses. Chief Earl has already used bleach on a pair and we haven't had any adverse reactions to it. So right now we can use bleach or potentially this other solution.
All right, talk a little bit about what equipment needs to go in.
Minimal. So if we have a respiratory issue, one person goes in, we need to non-rebreather, bag of mask. They can make that determination. So we take O2 tank and airway adjunct in. We don't need to take the whole bag in because that's a whole heck of a lot more stuff that we have to decon. So we need to go back for a second though, because if we have a positive screening with an acute illness going on, i.e. severe respiratory distress,
Cardiac.
chest pain, cardiac, whatever, then we're not gonna stage, we're gonna go in. One person goes in, establishes what he needs, and then relays that to personnel that are outside that are prepared to come in dressed in appropriate PPE.
Okay, so if I'm sending in one rescuer, what is the rest of the crew doing?
They're gonna stage that equipment outside and getting their PPE on.
And whatever equipment's needed, they can do it by radio,
Yeah.
put it on the porch. But we still want to get these patients outside, right?
If we can get them outside, then we wanna do that.
Okay. All right, can you talk a little bit about if we have to drive a patient in?
If we drive a patient in, we still need to have a mask on, and I would still recommend wearing eye protection unless it's gonna affect your driving ability. But we need to make sure that before we touch the door handle on that ambulance, we need to make sure that our hands have been sanitized. Before door handle, before the steering wheel, before the gear shift, radio, mic, anything, all that has to be, we have to make sure that we are clean before we get in there. But you have to continue to wear a mask, and that is per CDC and DHEC guidelines.
And we'll wear that all the way to the hospital, and then we'll decon at the hospital.
Yes.
10-4. In the event that we have one of our guys in who would be what we would consider dirty, we've got somebody outside that had no contact.
Yes.
Does their stuff have to be disposed of?
I wouldn't think so. Anytime you're outside that 6 foot range, I think we're gonna be fine, but if they're outside the house with a patient inside and they have no close contact with them, I think that stuff is gonna be, should be fine.
However, if you've donned a mask, you own it.
Yeah, that's your mask, so you can hold on to it for the next one.
All right, so first thing, donning and doffing our equipment, we want to make sure that we are, we're going to do our mask first. So make sure, first of all, make sure the nose piece is up, straps are hanging down. So we would go up to our face, go underneath the chin and on the nose. Then we take our top strap and go up over top, it'll be above our ears. And then our bottom strap will go down around the neck. We want to make sure, around the nose, make sure we got a good seal. You can take both your hands over your face, make sure it's breath. I do. All right, so once we get the mask on, then we want to put our eye protection on. It's pretty self-explanatory. We didn't iron this before we gave it to you, but we're putting that on the gown on. Might need some help tying. Now you can wrap all the way around if the straps are too long. We'll have that issue here. All right, so now we're gonna put the gloves on. The gloves we want to go up over the sleeves. Mr. Collins. Now we're ready to go in and fight the fear virus. You know that, right? All right, so we're removing our equipment. We want to start with our gloves. We pull from the outside of the first glove inside out and go to the inside of the second glove and from inside out, one inside the other, and we dispose of them. Now we're going to remove our gown. We get it untied, and we can rip these. Go from the inside of the around the neck area and pull it. As we ball it up, make sure we keep it inside out. Place it in the bag. Hand sanitize. Now we're going to remove our eye protection. Now these can be sanitized.
In this demonstration, Lieutenant Smith is the instructor. You would not hand your safety glasses to somebody who is not gloved.
So we can reuse them. And now when we remove our mask, we want to grab the bottom strap, hold tension on that, make sure we don't touch the front of the mask. Keep it here on. And now with the other hand, remove the top strap. Place that in the bag. Let's seal the bag. The bag will be placed on an ambulance, and then once the bag is sealed, then we would hand sanitize again.
All right, so this video was kind of a trial run to see, one, if we could pull it off. Is it beneficial? Will the guys watch it? I've got the technology. I enjoy the technology. So if this is beneficial, let us know, and we'll continue to put these videos out. I think it's a great way that you can get a true read and a good feeling about what the department's doing to protect you, what our plan is, what our vision is, and really how we move forward through this event. As I've said in everything I put out, that this situation continues to evolve, and we're working hard to evolve with it. What we really strive to do as administration for your fire department is to actually get ahead of this. And we've done a great job as far as securing supplies and trying to open up those supply lines to make sure that they keep coming. I know I've reported, to y'all early on that we don't have the medical equipment to sustain or medical equipment to protect as we move forward at the burn rate that we're going through them. Now, since those memos have come out, we've been able to secure some things. So what we're working as an administration now is, okay, where are we going to be in a week, 2 weeks, 3 weeks? And we're trying to get ahead of that curve. So just know that we're working hard for you with a complete focus on the citizens. I appreciate what y'all doing. I appreciate the hard work that's going in on the shifts that's had to deal with this, and continuing to serve the citizens of our district.